Great. Welcome back, everyone, to the House Healthcare Committee. We are moving to the governor's recommend budget. We're just going to have a committee discussion about where we are with testimony on the major ones, and then if there's requests for more testimony, so we can be prepared to have all of the information we need to make our decisions next Wednesday. So on the House Committee page, there is the budget under Diane Lampher. And we're just going to start with section 1. And again, I'm not going to go through each one. I'm going to pick really the big ones, but stop me if you have questions on any of them. So on page 1, the 4th row, this is under proposal. It says dental rate increase. So this is where the governor's budget is recommending that we increase dental rates for Medicaid to 75% of the dental rate. If you remember, we heard from Diva and we heard from the dentists. Daisy does, as our budget liaison, have some additional questions for Diva. And so they're coming back in Thursday afternoon to talk to us about our questions. But besides that, is there anyone else, because this is a big dollar amount, anyone else that you all think we need to hear from? Art?
This is just for dental, correct?
Correct.
So are we going to hear from anybody else where there's a great gap? Yeah.
Yes. So we have, so tomorrow afternoon, we're going to have Diva come in and talk about, so there is a recommendation, we'll get to it, for Medicaid increases, not very much. And so we're going to hear why they recommended what they did, what the methodology was around it. Then we are hearing from Vermont Medical Society, which will talk about primary care. We're going to hear from an independent, Health First Independent Provider Association. We're going to hear from the FQHCs, and we're going to hear from Home Health.
Okay, so we are going to hear from
Yes.
those in terms of the Medicaid
Yes.
payments they get.
Yes.
Because I think we heard from a few number of people that it's really a problem,
Yes.
and I just want to hear more.
Yes, absolutely. We will definitely dive into that. Leslie?
I just want to make sure my question's on the list, which is for the dental rate, is this increasing, is it ongoing? Will it be pegged to Delta dental rates?
Yep. So that's one of the questions I think we have asked to them, but that's,
Yeah,
I know you keep saying to put it on the list, but I'm hoping you're keeping your own list
Oh,
so that when they come in. Okay.
I just wanted, I don't want to be redundant
Yep.
about worrying or whatever it is I might be, but I.
Right. So is it base funding or is it one-time funding?
No, it actually more is it pegged to Delta dental. Because right now we're.
Ongoing.
Ongoing.
Okay.
And would we like to hear about the cap?
We are going to hear about the cap.
Okay.
Yep. I'm just making notes. All right, so we'll hear from Diva and then that should be good with the dental. Then the other one that we had questions on was the one right below it, which was the drug coverage changes with pharmacy benefits. I've just asked Mike Fisher, healthcare advocate, to come in and provide his testimony on that and then have Diva come in as well. Because we don't, so this is taking some drug coverage away, I think, from people in Vermont. And so we need to really better understand that. So we will take additional testimony on that.
That was my reminder to go back to committee.
Can we have,
Happening in 5 minutes after.
can we have Jeff testify as well? Is it- I'm not sure who that is.
Can you, so we can send him the language and see if it's something.
Can I ask a question about the Medicaid thing too?
Yeah.
Is this an opportunity to talk about how there's like people not getting what they need? Like, for example, like I have a constituent who's a doctor who's written multiple times saying that there's certain medications that used to be covered and now they're being denied. And there's some people who that's the only medication that helps them. And now they're facing like not being able to have this medication and like their quality of life declining. It was like just heart-wrenching emails that I've been getting about this kind of stuff about people not, and I don't know if it ties directly to Medicaid or not, but like it's.
So I think so in those type of circumstances, and we all get these types of requests, I think the first question we have to ask someone is, who's your insurance with?
I can look like.
And then we need to reach out to those people and then get some answers before we, I think, put it in front of the committee. So,
And my pharmacy bill might be, because I bet it's a pharmacy benefit manager related issue, because they change their formularies on a regular basis to exclude specific medications intentionally.
Yeah, this is the kind, it just doesn't seem right that people are living on a roller coaster like that. Like, it's just
Nope.
not fair.
it's not. All right, so then we're gonna go to page 2.
I'll look it up to see if it's Medicaid real quick.
So, a lot of what's on page 2, except for the last one and the third from the last one. So we're, caseload and utilization, the drug coverage changes. It's listed in 2 different places. We'll talk to Diva about it. Caseload and utilization and buy-in caseload and chip change, overtime for the River Valley. I mean, some of these things really just aren't, we just have to do them. So I would say on page 2, we're looking at the mobile crisis response of 3.3 million, and that we will hear from DMH and Vermont Care Partners tomorrow. One second, Art.
Yeah.
And then the 988 suicide line, we will also hear from tomorrow. So any other questions or comments on page 2?
Well, I have a question overall with this, and it's always the thing I have a question about with these graphs. Is there a way we can determine what's general fund versus other?
Yes.
And also what fiscal year 23 budget was versus what's being asked this time? I mean, to me, that's really where the rubber meets the road. I want to see, these numbers are fine, but they don't tell me much. They just tell me what they want now versus what
they had
last time.
So I would say I think what's come out of all the conversations we've had is that we have to explicitly ask the witness in front of us to get that information back to us. That there is so remember we went through the budget documents with Sarah Clark from JFO.
Yeah.
And so in those budget documents, we can see the overall base or 2023 budget. And I think we can see 2022 actuals, but we don't see it at the level of this. It's at a higher level, right? And it doesn't drill down. So if you want to know, for instance.
Yeah, I mean, I get what you're saying. So it's going to be, but if we knew what B310 was as a whole, at the bottom of the 310 list, say on this page, or the bottom of the 314, the whole amount, that would be enough. I mean, you don't need it for each and every one, but if we just.
I would say what I'm going to ask you to do is get with Daisy and see if we have it. And if we don't, task you with reaching out to DIVA or DMH with specifically which ones you want, unless you want all of it. And that's.
I mean, I think we should, I think to make a budget that makes sense, we would want all of it.
I would agree with you. It is not how the governor's administration presents it.
Yeah. I mean, because like I say, is this up or down or?
Well, you can tell if it's up or down because, so for instance, if we're on page 2, and we're looking at the first row, it says minus $500,000. That's down. So basically.
That's down $500,000 from last year?
From last year. They're reducing $500,000 from that program.
But we don't know the base, so.
We don't know the base.
Okay, well, I mean, even if we just had the base from I don't know, it just.
Art, I can help orient you. And DMH, when they give us their budget narrative, that is following specific instructions that they get from Adam Gresham.
Yeah, from the
So
governor.
they're just following directions, and if you go to the
Right.
DMH budget, they do have how much of each fund is in there. And this is something that appropriations put together. It's not their fault. And then if you want the B10 line, that's actually in the governor's short book that Leslie's looking at right now.
All
I can
I
help.
can say is we shouldn't have to go through these gyrations. They should be there.
I think
We're trying to build the
great
budget.
if you reached out to the Commissioner of Finance and expressed your
Yeah,
interest.
I mean, I will.
That'd be
I mean,
great.
Because these numbers should be there. I don't know how you build, I mean, no, I can't imagine anybody building a budget like this. You're gonna wanna know the percent increase,
Okay.
but
Yeah,
that's
we have
just
it.
me.
We have
All right.
it. We actually have it.
So I'm gonna let you guys work on that, and I want to stick to what we're doing right
Look at
now.
it later.
So let's have one conversation. Leslie,
I'll-
one conversation.
Yeah, I'll figure it out.
So on this line, we're doing mobile crisis and we're doing 988 tomorrow. Anything else on that page that's raising? And again, we can go back to all of these, but like if something really sticks out that you say, oh, I need to hear about that, let me know. So then on page 3,
Can I ask a question? I'm looking at clawback, which is not something that is obvious to me necessarily, but I wouldn't expect us to have to pay out for clawback. I
yeah,
thought,
so a clawback is where we've spent federal dollars and the feds are now saying we want that back.
oh, clawback,
for some reason.
I thought we were clawing back from other people.
No, I wish, no.
We do that too, I think.
Yeah, but no, so this is clawback from the,
Okay, good.
yeah.
Yeah.
So on page, am I on page 4? No, page 3, thank you. So on page 3, we're still under DMH, and so the 2 line items there that really have any money are the 4th line and the 5th line, so the peer support credentialing, which we talked about today with Wilda and Patricia. They are gonna put in writing the proposal that they put before us so we can understand what the money will be used for. I mean, they told us, but we'll have it in writing and timeline. So my question would be for that one, and you don't have to answer right now, but I want to know in the next 24 hours, is there anyone else we would need to hear from? You all would need to hear from to make a decision on that.
Got a question.
Yeah.
Because I'm not familiar with budgets, but
Yeah.
that one there is 375,000. That's coming from the state of Vermont. Does it show what else they get for money? So we see the total that goes to the peer support?
So for peers, so this is a program that's new. So there's no money that goes right now to peer support credentialing because it's not something we have. The other problem with this proposal is that the 375,000 is the gross. No, that's the state funds amount, right?
Sorry. You're talking about the peer thing?
Yeah.
They asked for 187.
That's with the match.
So it was 75 and
There's
there's,
the match.
It includes the match.
yeah, I think that's.
That's what they said.
Okay, that includes the match.
That's what the.
I thought it was
170.
125.
Hold on.
Okay.
87 for the general fund.
So to your point, this is the gross number.
Okay.
In our documents, and when we review this, we'll have the gross number versus just the general fund dollar. So, and I'm gonna make a suggestion that when we do this next year, we have both of those columns, because that would be helpful.
It sounds like they're standing up a new profession, so I don't know that we necessarily need to hear from OPR, but I didn't know what impact it might have on OPR.
So I have a note to reach, that's a good one, to reach out to OPR and at least provide written testimony if they don't wanna come in.
Yeah.
They did a lot of that last year, didn't they?
They what?
Didn't they testify on that last year?
Yes, they testified in our committee last year for a different proposal, but similar, where they wanted to do the credentialing. So, but we can get their feedback on this one. So, yeah.
Okay, here we go.
All right, and then the next one, we also heard from, I think just this morning, but it seems like forever ago, therapeutic alternatives to EDs in the Northeast Kingdom. So that was Kelsey. And was it really just this morning?
Yeah, it was yesterday.
I know,
It was this morning.
and Allison Crump from Department of Mental Health. So again, if you have off the top of your head, someone else you would need to hear from on that. Art?
Yeah, and maybe I was zoning out thinking, trying to digest all the stuff we're digesting, but Is this figure for the refurbishing of a building and the whole thing? Or is this strictly for, I don't know, other things to do with that?
So I think it's for, and correct me if I'm wrong, I think it's part of a larger number that they've gotten from other partners.
Okay,
That part of, so,
This is our-
so the whole, this is our piece, the whole will be to have a place, to have everything in one place. But until then, they believe that they can start, some of this when the budget is finalized, July 1st, in places they already have today.
this is an editorial comment. This is one of the better things I've seen us try to do.
Yeah.
This needs to be done.
Yeah, especially in the Northeast Kingdom. Leslie?
I'm not sure where this lands, but they made a legislative request, so I don't know where that conversation comes.
So their legislative request, they had two. One was this, and the second one is Vermont Care Partners, which we will hear.
Oh, so the 10% thing comes from them?
Yeah.
I think you said that this morning, sorry.
That's okay. All right, so I'm going to say that we're good there unless people have something.
What do you mean, a legislative request? Like the.
So in their presentation, in Kelsey's presentation, at the very last page was two legislative requests. One was for this, and one was a continuation of the overall DA request for a 10% increase in rates.
But the therapeutic alternatives to EDs and the NEK, the 1.5 is in the budget.
Yes. It is in the budget, yes,
Okay.
yes. The 10% is not.
Okay.
I wish Woody was still on the committee for this.
I know.
He's on appropriations, so he'll see it.
Oh, Woody, yeah.
Yeah.
Because he was always advocating for his region, and this sounds like a great.
We'll tell them we cut Newport out, though. That can't come here.
We don't mean that for whoever's listening.
Tell him
I'll have to.
Burlington's annexing Newport
We
into
had the
Chin.
thing and it was everything but Newport.
All right, so then we move down to one, so everything above it is base, and then we move into one-time money. And so we have not heard from any of this except for the last blueprint. So we have a request here from Green Mountain Care Board, which I know Daisy has done some work on, so we will hear from Daisy on that. And not right now. And then the healthcare workforce position, the second to last row, is that something we put in legislation last year? And so that is funding that we, I would hope we would continue to support because we required that position last year.
Has that person been in to testify yet? Is there a name?
They just posted the job.
Yeah,
Okay, so it's not a job that's functioning yet.
Not yet.
exactly.
Right, so why cut it before we even gave it a chance?
Right.
Yeah, I think- yeah,
Good point.
yeah.
So if I can. I'm not sure I understand why something doesn't become part of the ongoing budget and why it's only one time. What's the rationale?
So it could be a couple different things. Could be that it's the only money we have available for the project, right? And so it's one-time money.
I'm just thinking about the secretary's office, healthcare workforce. Oh, yeah, so they never filled it, but I guess they'll maybe just keep putting in until they do, or I'm just thinking, all right, never mind.
Yeah, I mean, I think it can be multiple different things. Sometimes we put positions in for a period of time. I don't remember this one. I'd have to look at the act.
Yeah.
I don't know if anyone
You're
remembers.
talking about the healthcare workforce position?
Yeah.
That one was funded with ARPA money in fiscal '23.
Right, so that's why.
Cool, could we have yours then?
That's why she's the Daisy.
I know.
Budget liaison.
She's our diva.
Get in the detail.
Alyssa?
Well, I just wanted to say, I mean, if anything, I want to hear about it. I still don't understand all this blueprint money.
So, yes, so.
It's a lot of money.
So I have asked Nolan and he has sent something to me. I have not seen it yet, but once I read through it, I will send it to everyone. So if you add up all the lines of blueprint, it is like $41 million, but it's not really $41 million. So one, he's found a couple mistakes on the numbers, and two, some of it's the same pot of money in two different places because of the way the agencies work. So he has put something together. We will have him come in and walk us through that. And then I've also asked Blueprint for some more additional information.
I also asked AHS because the governor's budget summary says it's 42 million.
So we will definitely get to the bottom of
It's
that.
probably part of a bigger project that builds around that one small effort in the blueprint.
Because we've really only heard about
Two things.
increasing the CHT, which was what, about 8 million?
So it's increasing the CHT, it's funding for analysis of the project they're gonna do. And there was one other.
Didn't we hear about Hub and Spoke?
Dulce. Hub and Spoke is part of the CHTs, Dulce, and then funding for analysis. Daisy, hold on.
Different subject.
Okay, stick on this one.
Well, just when someone said that the same money appears two different places in the budget, my ears kind of like, that doesn't sound good to me.
We're gonna have Nolan walk us through that.
Thank you, because I mean, like, really?
It's a complicated budget.
Daisy?
Well, Substance Misuse Prevention Coalition, the policy, and this, I may punt
So we're on
to-
page 4, everyone.
I may punt it to Human Services because their annual report, VDH is recommending that they only report to the legislature every other year now. And we're still asking, or they are still asking for $1.5 million. So I
So
think
I think that's a punt to Human Services, get with Dane. I'm sure he knows
Which item?
exactly.
that's B 1100 A18.
Thank you.
So let's do that. Let's go to the top of that page. So there's $10 million to address the emergent and circumstances impacting healthcare providers. I've asked AHS to come in.
Yeah, well, that's very vague.
Yeah, so they're gonna come in. This is, they've had this program through COVID, and so they've been able to basically help healthcare entities who are struggling through COVID. And so they're gonna come in with projects they've funded, ways they've helped, why they think there's still a need, and will explain all of that to us. And as well as the one below it, which is case load pressures due to the suspension of Medicaid redeterminations. And then everything else on there is basically Blueprint for the Substance Misuse Prevention Coalition. So Daisy can work with Dean on that, and then federal funding for Blueprint.
Are the community health workers covered in here somewhere?
So that's under the Blueprint for Health Hub and Spoke.
So they're covered under that. There's more than one line item for them.
Right, so we're gonna have Nolan walk us through what
Thank
all
you.
of those different line items are. So that's everything to do with money. So really what's outstanding, the really big items, is we're gonna have Diva come back and talk to us about the dental rate increase and answer some questions and talk about the cap. You know, there's that $1,000 cap for adults. What would it mean if we remove that? We're gonna talk about the mobile crisis tomorrow, additional funding for 988 tomorrow. I'm sorry, what? 988 is next week. We're gonna talk about it. Thank you, Claire. And we're going to hear about Medicaid rates and hear about Blueprint. And then we have on Friday, people who are going to come in and talk about proposals they would like us to consider because they did not make it into the governor's recommended budget. So that will be EMS rates, home health, Medicaid rates, and one other one that I'm forgetting. Sorry,
Can I add one?
maybe.
I have a bill that would require commercial and state insurance to cover donated breast milk, pasteurized donated human breast milk for infants under 12 months of age under certain circumstances.
So is that change of policy as well as a budget request? Okay, so let's talk offline to see if it's something we can get in or not. Is it
Okay,
Medicaid
just
money?
yeah, commercial and Medicaid. So just in a general context, not about this bill, when, even though we're working on the budget now, we can still add things that have to go through appropriations.
Our crossover is March 17th. Yes, so this is the bill we could take up after we do the budget and still get it out by March 17th.
Okay,
Yep, and still make it to amending committee.
okay.
Does everyone get that? Just the process. So so the governors recommend budget. We have a deadline from appropriations of March 1st. But if we have additional bills that we want to pass out policy-wise that have dollars associated with them, we have until March 17th to do that. And then they go to appropriations.
And so I think I get your point, which is we have to get through the initial budget recommendations by March 1st, then we can look at what else is left, and then we will circle back to the budget when they approve it.
Yes.
Yeah.
When appropriations.
Yeah, like in other words, we give our recommendations, we work on other stuff, then they come to us with the final budget, and then we vote on it as a house.
As a house,
Yeah,
yes,
all right.
yes, correct. Yep.
Does that make sense? I would confuse it, but like I was listening to you and thinking about it. So then I'm also hearing, and you might be like, no, that's not at all what I was saying, is that if we want to take issues up with you, we can lobby the committee to take them up between March 1st and March 17th, most of which is a break, but
Yes.
yeah.
There's a week
Yeah,
break in there.
yeah.
So, but again, remember, we're the first year of a 2-year session. And we can work on anything through the whole rest of the semester and send it over semester, sorry. The word semester, I feel like it, right? Anyway, and then it would potentially get taken up next year in the budget.
So we could take testimony on something without passing a bill, or we could pass it and it'll go wait in the rules committee in the Senate. I mean, that's the other thing.
Exactly, yeah.
I don't know if people understand that part of the process. That if we pass a bill after crossover, it doesn't die. It goes to the Senate, but then it goes to the Senate Rules Committee. And they could choose to move it. It doesn't have to stay there, but often they stay there, right? I mean, that's
And then
my
it goes to
estimate.
the committee next.
Yeah, the next year.
Does it always go to the committee next year? Not necessarily.
No.
I think rules can hold it hostage and kill it if they want.
That's what I think, yeah.
There's all kinds of ways things could get killed through the process here, I've learned.
Yeah.
We could have a special meeting on that.
Exactly, we can
Yeah.
have a whole other discussion about that.
Although I'm afraid to tell people everything, they might get ideas.
So what,
There's a planning session at the Capitol Plaza on the 3rd of March. Should attend that,
Planning session?
Who's planning?
on what bills are gonna get killed.
Are you joking?
Yes, of course I am.
all right, let's get back to focus and if we focus, we can be done early. So,
You're being very teacher-like
I am being very teacher-like today.
So I'm looking for that bell, you know, you.
Exactly.
Ding.
Ding, ding, pay attention. So anyway, that's where we are with the budget. And I say all that to make sure we're all grounded in where we have to go. It's a lot. We'll get there. Please feel free to come to me out of committee if you have questions about the process. We'll make sure that, we have the information we need to make decisions, but at the same time, I think we've all learned now, sometimes we just have to make a decision with the information we have at hand. And then the other thing I want to say is we will have to prioritize these. And we cannot abstain from voting on prioritizing items. It is the only way we can move things. And it's really hard, right, to say we support one thing over another. But again, that's why we make the big bucks here. Why we got
Wait a
elected,
minute.
right?
It's not big, let's just be clear.
It's not big, okay, that's.
I don't want people to think I'm
No.
getting paid a lot for this.
It is, we get paid nothing for this.
Yeah.
But we are having to make these important decisions, unfortunately,
Yes.
to sometimes choose one thing over another. So be prepared for that discussion as well.
These positions that are in here,
Yes,
we're gonna talk about them at all.
the positions.
Which one's top part?
In Beaver and the Agency of Human Services.
Is it the reclassification ones?
Do you want?
5,
Age.
Is it row E 100,
yeah,
B
A and B. It says multiple
Yeah.
permanent positions.
So that second one in DIVA, the executive branch positions, convert DIVA positions from limited service to permanent.
Yeah,
I have a question into them about that.
yeah, that's one of them. How
'Cause
about
it's-
the one above that?
Multiple permanent positions at DMH, that is to add the 4 positions for the mobile crisis
Oh, okay,
unit that they're adding.
okay.
Which we'll hear about
Yeah,
that
okay.
piece of it.
It's the DIVA ones that are interesting because it's about 30 something positions.
Limited service to permanent?
Yeah.
Yeah.
All right.
So, I'm sorry, were you gonna say something?
I was just gonna say, so this is the document we're working off of. If you have questions, come see me and we'll do the best we can to get the information and get through it. That's-
Yeah, okay.
And I was gonna be done.
All right, so you were basically wrapping that up.
Yeah.
And my question is kind of, it follows that. So I'm hearing that now is the time for us to direct our attention to the budget,
Yes.
come to you with requests for testimony. I'll look at it again and think about that. What's happening as I do that is there's questions about things that aren't addressed by the budget. So maybe this is like a request for the committee to consider is after, because we have to get through this, like there's pressure. Once we get through the budget, might there be a little bit of time, even if it's a half hour before we go on break, to talk about, to brainstorm what are some of the unresolved issues and what are some of the, because they may not be bills. So it's like issues and bills and then sort of make our request to the committee leadership for testimony. So then you can take that into consideration. Because like one of those issues, not to get into it now, is related to prescription drug coverage. I don't know where I saw that United Healthcare was like dropping.
Yeah, they're,
Blue Cross Blue Shield is no longer making the per member payments to the primary care offices, which is causing them to go into like a financial crisis. There's like some
There's a
major
lot.
things happening. And it's just concerning to me that we haven't had.
The time.
Yeah, so that's one, and I'll put it on the list. But it's like, as we were talking about the budget, I was looking and I'm like, I'm writing to this doctor and he's saying like, yeah, it's Cigna and it's United who are the
Right.
problems.
Oh, can't do anything
We
about
can't do
those.
anything about those. So.
Unless we like move to universal healthcare, but.
So I'm gonna go back to that general, I think, concept, hold on, is that, so the plan for the next, I don't know, 2.5 weeks we're here, I don't even know how long it is. We will do the budget. We will be taking up the final 2 compacts that we have on our wall. We will be taking up the suicide prevention bill, and we will be taking up the DIVA technical bill. Those are the must-do.
We have 1 week.
Before we leave, right?
It's 1 week.
Well, 4 days and 2 days this week, Thursday, Friday,
Yeah.
so we're done, next week. So we're done with the budget on Wednesday. Those are the 4 things. It is my hope we get out. But yes, then the world kind of opens up to us again because we can take up what's priorities for our committee until we start getting some of the Senate bills over. And even when we get the Senate bills over, we can decide whether or not we're going to take those up.
Or what we can add into.
Or we can, right, so yeah, so if there are, important issues that you want to take testimony on, that you want to understand better, come to us and we'll come up with a game plan for after we get back.
so it would be helpful to me and with your permission and Claire's permission, would like to start a document, if Claire, you're willing, that lists like a spreadsheet that has a list of unresolved issues and then in another section, things that committee members, like some of the bills, I'm talking about myself, that some of them are 2-year type bills, some of them I think are 1-year type bills if possible. So can we do that?
Can you start that? And we can put it on a Google Doc so that we all have access to it. Yes.
Yeah, and Claire, would Google Doc or something on?
Oh, either one.
Okay. I'll do Google because I don't use the State House, Microsoft, whatever it is.
What's the goal of mine?
So we can all see what we are all thinking about.
It's like a map of our priorities.
Yeah, what are our priorities? So we can all see them. They're not just in my head, they're out there so everyone can see Brian's priorities, your priorities, they're out there on a piece of paper we can look at. It helps me organize.
And then as a leadership team, we decide how we move forward with what, when.
And you can
what
see it where
maybe
there's
doesn't-
intersection.
Maybe what
Yeah.
doesn't get taken up right away. Leslie?
It's heavy.
So I was just gazing at our guiding principles and wondering how we think about this budget in the context of our guiding principles. I mean, we haven't ever done that before. You guys have your back to them, so you don't need to think about
I
it.
know. Topper looks at them a lot.
Yeah. So I'm not sure how that works, because this is, the first time we've had that, but it's an interesting question to me.
And honestly, I don't know how it works either.
Yeah.
I mean, I think we have to use them all in our own personal decision making. And then,
Well, yeah, you can use them on your own, but we've agreed to them. So we should be looking at them every time that we vote on anything in here. Actually, before we vote, we should be making a statement like, aiming to do no harm as well as repairing any harm caused by systemic oppression. Think about that. When we're legislating. That's what they're for.
Of course, we might have different interpretations.
Absolutely.
right,
Well, there's no doubt.
right.
For example, like some people might view reducing access to firearms as repairing harm or doing no harm, and others might view it as harming people,
Right.
So.
But that makes it kind of legitimate in some way, if we think about it, in that kind of way, I think. Well, I don't mean legitimate, that's not the right word, but it adds perspective, let's just say that.
But what'll happen is the majority of the committee, no matter how each one individual interprets this thing, the majority of the committee will interpret it whatever way they want. And that's the way it'll come out of the committee that way.
Right.
So for instance, if I thought that we were doing harm to people with the bill we just passed, I made that point all the way through. The committee voted a certain way. I'm fine with that.
Right. It doesn't mean we're all going to agree
No,
and have a
no.
unanimous
Yeah.
No,
committee vote.
On everything.
because of the interpretation piece.
Right.
But at least we've got some guardrails.
Okay. I think we need a break before the floor. Thank you, everyone. We will be back here tomorrow at 9 a.m.